Now with our GMA cover story, it's National Youth Heart Screening Day, and we're looking at kids and heart health this morning with Dr. Edith Bracho-Sanchez, pediatrician at New York Presbyterian Hospital, Columbia University. Doctor, good morning to you. It's great to have you back.
Great to see you.
So I'm a parent. I have two kids, and we were just talking before. Heart health is not always something that you're thinking about with all the other stuff that you're considering with your kids. So what should parents be looking at, and what do they need to know?
Which I have to tell you, anytime we think about any type of health, but definitely heart health, we're thinking about the long-term preserving health and promoting health. And we're also thinking about the short term. What are the things that we need to be aware of right now that might signal that there's a problem? So promoting health, we're talking about healthy nutrition, healthy sleep, avoiding stress, checking high blood pressure, making sure that blood pressure is under control, which you would think is an adult thing to happen, but can definitely happen in kids. And then short term, we're always looking out for symptoms that might tell us that we need to pay attention to the heart right now with.
And on that, it's like, look, as parents, you don't need another thing to worry about and have anxiety about. But if we're looking at symptoms, what are the specific things that we need to look at to indicate that there may be a real problem?
Absolutely. I'll tell you what we look for as pediatricians. And remember, we're always partners so that you don't have to be constantly thinking about this. We're looking for chest pain, chest discomfort, especially in the context of exercise. We're looking at shortness of breath. We're looking at fainting, history of fainting. And we're also looking at whether these things are out of what you would expect for age and overall health of the child that we're seeing in front of us. Of course, it's always so scary when you hear reports of in the news of things like sudden cardiac arrest and things like that. But listen, these symptoms tell us that we need to be looking, we need to be thinking, and we're here as pediatricians to ask you about them.
And what are the screening options available? And at what point do you go get a screening for your child?
So every year we're supposed to be screening, or at least every 3 years per the latest recommendations from the American Academy of Pediatrics. And any screening begins with a really good history, not just for the child, but for the entire family of cardiac disease, especially before the age of 50. We're also looking at a good physical exam, of course, and we're looking at those symptoms that we were asking about and whether those symptoms are what's to be expected for age and overall health. And really important to know what's for every parent out there, that it's not just teens who play sports that need to be screened, is every child at least every 3 years.
Critical information. Truly appreciate it. Always good to see you back in the studio
Thank
here.
you.
Dr. Edith Bracho-Sanchez, we appreciate it.